Circulation of blood through skin is called as cutaneous circulation. Skin is an important structure of the body as it covers the body and protects the whole body. Cutaneous blood flow plays an important role in temperature regulation. Blood supply to the apical areas such as fingers, toes, feet, nose, earlobes. At the boundary of the dermis and subcutaneous tissue, an arteriolar arcade is present from which the arterioles ascend from the deep dermis to the superficial layer of the dermis, forming a second network. Capillary loops originate from the superficial dermal network and perfuse the dermal papilla and epidermis. The dermal arteriolar arcade also provides vessels that supply hair follicles, sebaceous glands, and sweat glands. Non-apical areas like body, torso, the direct vascular connection between arterioles and venules, which are known as arteriovenous anastomosis, mainly occur in the superficial and dermal tissue. Arteriovenous anastomosis are absent or very few in the non-apical area. The normal value of skin blood flow varies from 1 to 150 ml per 100 gram of tissue per minute. So this is the diagram showing where arteriovenous anastomosis occurs in the skin. The skin blood vessels are supplied by sympathetic fibers. There is no parasympathetic innervation of cutaneous vessels. Activation of sympathetic fibers results in vasoconstriction, and vasodilatation occurs by decrease in the sympathetic activity. Regulation of cutaneous blood flow. It is regulated by the neural mechanism, thermal and metabolic mechanism. The cutaneous blood vessels are supplied by sympathetic vasoconstrictor fibers, and there is no vasodilator system supplying the skin blood vessels. It is also regulated by the thermal mechanism, that is, increased body temperature causes vasodilatation and decreased temperature leads to vasoconstriction. Metabolic regulation occurs but it is not that important for cutaneous circulation. However, local production of bradykinin in sweat causes cutaneous vasodilatation. Physiological and applied significance of cutaneous circulation lies in the vascular responses to injury and temporary occlusion. So vascular response to injury may lead to two types of reaction: white reaction and triple response. White reaction occurs in response to light stroke, and triple response occurs to reaction for a firm stroke. White reaction: when skin is stroked lightly with a pointed object, the stroke line becomes pale. This is called as white reaction. This occurs due to the decreased blood flow in the capillaries due to the contraction of the precapillary sphincter in response to injury. The response is observed about 15 seconds. Triple response occurs when skin is stroked firmly with a pointed object. The response is called as the triple response, and it has three components. They're called as red reaction, flare, and wheal. Red reaction. The skin becomes red in about 10 seconds. This occurs due to the capillary dilatation that increases capillary blood flow. Capillary dilatation occurs due to the direct response of the capillaries to pressure. Wheal occurs because of the swelling that is because of the local edema and is called as wheal. This occurs within few minutes following red reaction. This occurs due to the increased permeability of the capillaries and postcapillary venules. The histamine released from the local mast cells causes vasodilatation and increases capillary permeability that results in extravasation of the fluid. Flare occurs because of the spreading out of the redness from the site of injury to the surrounding area, and this occurs due to the arteriolar dilatation, and the arterial dilatation occurs because of the activation of axon reflex. From the site of injury, the impulse is conducted in the afferent fibers. These sensory neurons give branches to the blood vessels. The impulse, in addition to its conduction to the spinal cord orthodromically, it also relayed antidromically to the blood vessels. Axon reflex is an example for antidromic conduction of the impulse. The endings of sensory fibers on blood vessels release substance P and CGRP, which produce arteriolar dilatation, and thus redness spreads out from the injury to the surrounding skin area to form flare. So this is a triple response. When a firm strike is done over the skin area, it is going to develop a red line, a flare, and wheal. Okay. And the red line uh, occurs because uh, the the flare occurs because of the arteriolar dilatation because of the axonal reflex, and the wheal occurs because of the development of the local edema because of the increase in the from the extravasation from the arterioles, dilated arterioles. And this is the axon reflex. Normally, uh, cutaneous nerve endings, they also send some of the nerve fibers collaterals to the arterioles of the skin. Okay, and when the cutaneous is are stimulated, and some of the impulses, they antidromically are conducted to the blood vessels, and they are going to lead to the arteriolar vasodilatation, and that will be responsible for the flaring response. Vascular responses to temporary occlusion, reactive hyperemia. This is defined as increased blood flow to an area when blood supply to the area is re-established following a brief period of occlusion. It occurs due to the vasodilatation produced by hypoxia during occlusion. When circulation is re-established, blood flow increases through dilated vessels and skin becomes red.